Something I didn't learn until I became a doctor was that Afrin can be harmful. Another creator recently shared her video on TikTok. This is Fred, talking about her experience with Afrin. I cannot find that video. If you know who I'm talking about, please tag it below. I think Afrin is the most commonly used nasal decongestant, but it's not the only one. Afrin is, the scientific name is Oxymetazoline, and to understand how it can cause harm, you need to understand how it works first. Inside of our nose, we have a lot of tissue and a lot of blood vessels that supply that tissue and that mucosa. What Afrin does is it causes vasoconstriction, or it causes those blood vessels to constrict or become very small, which can help to open up the airway. And for that reason, you should really only be using it 3 days at a time, because if you use it more than that, it can cause some complications. One of the most common complications is something called rebound congestion, which is when the Afrin wears off, its properties wear off, and then your body essentially tries to overcompensate, filling those passages with blood, and it can engorge your mucosa, which can lead you to having more congestion after you use it. And usually that complication will go away if you simply just stop using Afrin. Some patients who have significant rebound symptoms will be treated with things like nasal sprays or nasal steroids to help with their withdrawal symptoms. One thing I did not know was that for those who use Afrin or products like Afrin constantly or chronically, it can actually cause permanent structural damage to the nose, similar to the same type of damage that is caused by those who use certain illicit nasal drugs. I'm not going to say it because I don't want to get blocked. For example, one complication of chronic or habitual use is something called saddle nose deformity, and this happens because, remember, the nasal decongestion causes vasoconstriction. If you constantly use it, you're withdrawing blood supply to the important structures of the nose, and eventually it causes breakdown or collapse of your nasal bridge. I just think that that's interesting, and I did not know that until I became a doctor. The more you know.